C-sections. An emergency situation can often occur due to labor or delivery complications. Sometimes they are unavoidable. It is hard to predict which pregnant cat or dog will need veterinarian help during the seemingly routine event. But there are certain warning signs, breed, age, etc. For instance, females belonging to the breed with rotted hearts, like Persian cats and bulldogs, tend to require C-section more frequently than other breeds. Delivery complications are also common among tiny breeds like Chihuahua, miniature Poodles, and Schnauzers. But even for females belongs to low-risk categories, it is a good idea to receive a vet checkup ahead of delivery. It is not uncommon, for instance, for one embryo to grow so big that it makes the birthing process more complicated than if the mother had been carrying several smaller babies. Of course, there is no guarantee in such cases. Either once a while it might happen that 5 to 10 babies are in the womb and one of them is slightly bigger than others. Unfortunately, the giant will try to get out first, and it might get stuck and make it difficult for the others to get out. Another problem is a delivery tends to occur during the night. We teach the owners of potential new litters to recognize the impending delivery a day ahead of the event, but not every owner follows our recommendation. Of course, a planned C-section is more convenient both for the clinic and for the owner, and the planned female is an easy to schedule room for the operation, and procedure can be done during the day, which is obviously better than doing at night. The worst case scenario is when the vet belongs to a loyal client whom we do not feel comfortable sending to a specialized emergency hospital, and the doctor and team has to stay at work or even come to unexpectedly at night during off-duty hours. Miss Cherry was a renowned pug breeder and one of our pain in the ass clients. Her show dog female was preparing for her first delivery. The X-ray confirmed there were 2 embryos, one of them twice as big as the other. The day of delivery was well calculated. The doctor offered her to stimulate the mother to be in the morning so we could have several hours to supervise the birth and perform C-section if necessary. The breeder asked for an estimate and refused our price. She was trying to save money and hoping for off chance that process could happen without intervention. Several phone calls in an attempt to convince her accomplished nothing. During the evening, the beach started pushing, but nothing safe from fluids was coming out. 10 minutes before the night shift ended, Miss Cherry came back and accepted unavoidable. The doctor not only had to perform C-section, but also had a hard time restarting the heartbeat and breathing of the giant newborn puppy. It has been stuck inside the birth canal for too long. Finally, when everybody was aware and stable, it was time to pay the bill. But there was a problem. The owner insisted on paying the amount estimated to her in the morning, that morning, while we maintained the extended hours and complicated revision deserve extra compensation. A teenage girl brought in her tiny, lethargic Dutch hound. There was no external symptoms that could direct us to a diagnosis. The X-ray revealed that the dog was pregnant, and it looks like delivery was past due. The ultrasound confirmed that embryo was dead. Our question about mating date received no answer. The dog has no idea how the dog got pregnant. She told us there were no other dogs living in the house, and that when she went outside, she usually accompanied by human. Usually, that means there were times when she walked outside by herself, decided the vet. The C-section and spaying was the only way to save the life of poor Dutch hound. The owner, who was likely an experienced owner, had not recognized the proper time to run to the vet and unfortunately, mother suffered toxicity from the dead body in her unborn son. The endoscopy of the embryo revealed that it has been dead for at least a week, and the would-be puppy was giant, fully formed, and it looked like he was half Rottweiler. The whole family, the mother and father and two beautiful 20-year-old daughters, brought in their Shih Tzu for C-section. We knew the family very well. The parents had brought the female Shih Tzu in order to teach their daughters how to take care of somebody who depending on them, and they explained to teach them about some gender-related issues. The family knew that their four-legged younger daughter would be delivering 7 puppies, as well as the exact date of delivery. Also, they followed vet instructions. If the first puppy did not come out within 6 hours of the first sign of labor, they would have to go to a hospital. So here they are aware. The girl's pushes were sporadic and weak. The doctor stimulated her with oxytocin to not available. C-section was only a choice. Surgery went well, and soon 7 puppies, Greek and small even for that breed, were in our hands. The doctor was still busy with the mother, while all the puppies needed attention and help in dyeing of their coats and massage to stimulate blood flow, to help them breathe successfully, etc. We took the newborns out of surgery room, and everybody was available to receive a puppy to work with. The manager, the technician, the receptionist, the mother and the father, and even the 2 young girls. It was a wonderful collaboration between members of supportive team. The older girl decided that she would be a doctor when she grew up, and the younger one promised to be a vet.